Other news now. Hundreds of St. Lucians have received free dental services as the Great Shapes 1,000 Smiles program rolls out here with support from the Sandals Foundation. The U.S. charity organization has been working in Jamaica for the past 27 years, providing free health and education to nationals. The relationship was struck in the aftermath of Hurricane Gilbert. For the first time, the organization has extended its reach outside of Jamaica. The team of oral health practitioners will hold clinics in Marcia and Canaries for 2 weeks.
And it was obvious to us from the beginning that healthcare and education were two of the big needs in Jamaica anyway, to start with. And as we're looking to expand through the Caribbean, we're looking at what needs we can help serve and how we can partner with the local ministries of health, ministries of education, the people in the countries, so that we're making sure that we're providing services to needs that are relevant in their countries.
We have dentists out of the US, and in partnership with Sandals, we're able to provide free extractions, fillings, cleanings, and even root canals for the community here in Marcia and its environs. It was a bit of a tedious, task coming into a new country, but it's well worth it because of the response that we've been getting. It's been wonderful. I know that the persons here really love it. You know, all the little kids that we've been seeing and all the adults there, they're really appreciative of what we're doing, and it makes everything that we went through to get here so much more worth it.
Bringing this program to St. Lucia has always been a topic for discussion over the last few years. When we started in Jamaica, it was almost by accident, and it has grown tremendously over the years in Jamaica. Tens upon tens of thousands of people have been reached. And St. Lucia's population is relatively, well, not as much as Montego Bay itself, but we still tried our best to bring as many volunteers as we can. Normally we would have over 100 volunteers coming down to do the program, but we have just about 60 of them here with us for the 2-week initiative. We have decided strategically on where to place the clinics, so we're in Marcia now, and next week we will find ourselves down in Canaries.
You know, I think the most common problem is decay, cavities that have been there for a long time, and so the longer they're there, they get bigger and worse and worse. And at some point, they're just going to destroy the whole tooth. And sometime before that happens, they'll get a toothache, or they can get an infection, really. And it can be really difficult to eat, talk, smile, and get a job even. You know, if you're interviewing for a job where you have to have a beautiful smile and you have a big cavity there, then it's not going to be tough for you to get that job, no matter how good you are everywhere else. So it's really taking care of those teeth. And sometimes, I would say a lot of what we do is some of these teeth are so far decayed that they're really unfixable, and we need to take them out. But other ones, we want to fix them. We want to save as many as we can. So we look for those ones that we can fix this, we can save this, and prevent you from ever having to lose that tooth. But certainly if you have a toothache or an infected tooth and it can't be fixed, then that's the number one priority. We want to get that out of there so you don't continue to suffer with it.
We're looking at fillings, cleanings, we're looking at extractions, not braces, but we are pretty much offering as most services that you would likely pay for in a clinic right here for free. And the public is invited. We're hoping that the outreach, when we get to Canaries, we will be able to tap into those that need the service in Ansel, as well as those down in Soufriere as well, since Canaries is so strategically placed. And hopefully that by the end of the program, we want to reach at least 1,000. If we can do 2,000, I'll be even happier. The idea is the service is here, so St. Lucia is invited to make the best use of it. It doesn't matter where we are on the island. If you can find yourself to the clinic, come to the clinic.